Anna Luker, one of the pediatric hospitalists, and I co-direct ECHO together with Maya Maxim. I will be on board throughout our session, so if any questions come up, feel free to put them in the chat and I will pass them along. And with that, I will hand things over to our two speakers. We have Michelle Befi and Anna Stone joining us. And we are kind of doing a little bit of a follow-up session to a previous talk that we had a few sessions back on autism spectrum disorder and, integrating, building communities and how you as pediatricians can help families with that. So I will pass it on to our two speakers. Again, feel free to put any questions into the chat.
Great, thank you. Thank you guys so much for having us today. And are you seeing my screen here? Okay, great. Okay, so today I'm really happy and proud to talk to you guys about an article that we've recently had published with Catalyte Research Institute. It was published this February 2023 in the Family Journal, which is a journal that focuses on counseling and therapy for couples and families. And the focus of the paper is talking about our research into parents' experience of the diagnosis of autism spectrum disorder. So we chose to talk about this topic and to have this be one of our first published articles, because we recognize that a lot of research about autism and treatment of autism lives within the autism world of behavior analysis and the autism journals and those kinds of things. And when we started to look at the other journals that are out there, we just didn't see that much about autism. So we wanted to start kind of expanding the conversation and bringing in other disciplines, because if the CDC recently came out with some new numbers about autism, and they're now estimating that 1 out of 36 8-year-olds, which is 28% of 2.8%, not 28%, 2.8% of 8-year-olds have a diagnosis of autism, which is growing year over year. And this is huge. So that means that 2.8% of the families and the kids that you see coming into your practice potentially have an autism diagnosis. And so we want to start to reach a wider range of clinicians and pediatricians and behavioral health folks who are working with these families and with these kids. Just a quick introduction. My name is Michelle Befi. I'm a licensed marriage and family therapist in Hawaii, and I've worked in the autism field for the last 15 years, supporting young kids, adolescents, adults, and all of their families as they receive their autism diagnosis and they move along their journey towards living the most independent life that they can as adults. And I've been with Catalyte now for around 10 years, and I've overseen a variety of different programs. And I was lucky to be assigned to support Easter Seals Hawaii when we affiliated. And that's how I got out to Hawaii from California. And I'm so grateful that I now can call Hawaii my home since early 2020 and be a part of the Easter Seals Hawaii family as well. And a quick word on the Catalyte Research Institute. Catalyte supports both our California and Hawaii affiliates, and we have a massive data set. We have data on over 20,000 clients with autism and related conditions over the course of the last 10 years or so. And that's taking a look at that data set is really what inspired us to start the Research Institute, because we have this rich data set and we really wanted to be able to start to get some information out there and teach folks some of the things that we've learned. And the Catalyte Research Institute, we have a multidisciplinary team. My role on the team as a marriage and family therapist is to ensure that our research is focused on family systems and that we're always having some type of word in there to support families and not just individuals with autism themselves. So our learning objectives today, went over these. briefly got a quick snapshot of them, but we're going to talk about the research and what came out of it. So you're going to learn 4 themes of parent responses to their child's autism diagnosis and how those themes relate to one another. And then we'll talk a little bit about some strategies for assessing how the parents are responding to receiving an autism diagnosis for their child and some ways to support the family well-being. So the purpose of this study, when we sat down to do this study, we didn't have a hard and fast research question that we were trying to prove or disprove. Rather, we had a larger question of what's going on for these families when they're starting their treatment journey. We wanted to know, after families receive the diagnosis of autism and when they're getting ready to start receiving treatment, how are they doing and what is their experience? And through learning that, we were hoping that we could have some more information and insights into how to greet these families, how to get them started into treatment, and also to talk to other providers that are within their network and within their family of providers and help them understand how to best prepare them to start on this journey. And we know that it can be a lengthy and confusing journey. I'm sure, I don't know if any of you guys are developmental pediatricians. I hope so. Welcome. And we need more of you. But if not, I'm sure you guys are involved in the process and you know that there are wait lists. Families are waiting to get their diagnosis and then they're waiting to get into treatment. And it could be a really stressful process. Then once they get into treatment, it requires a lot of them. It is many hours of care that they're receiving, and it requires dedication and commitment from the family in order to fully engage in the treatments. And now the traditional models of ABA treatment, applied behavior analysis, which is the traditional therapy for autism, they focus heavily on the behavior of the child and improving skill acquisition, decreasing maladaptive behaviors, and really focusing on the individual child with autism as being the primary patient. We're starting to see that expand. We're contributing to that expansion and understanding that the parents and the family are all a part of this system, and everybody is impacted and everybody can have an impact on the child that has autism. So starting to shift the focus from how do we fix this child to how do we help this family improve their overall well-being so that this child has the best opportunity and the best space to flourish. So let's dive in. What did we do? We looked at a sample of over 4,000 clients that met certain criteria, primarily that their diagnosis was autism, and they may or may not have had co-occurring intellectual disability, but they had no other co-occurring conditions. So if they had ADHD or OCD or conduct disorder or anything like that, we took them out of our sample and we just stuck with the kids that had ASD with or without an intellectual disability. And we focused in on the answer to one question that we asked during our initial assessment, which is, what is your current understanding of the client's diagnosis? And our assessors are clinical case managers, and their role in this interview is to capture what the parents are saying as closely as possible and use the words that they use. And in our analysis, we initially looked into the different themes and all of these different ways to break into them, and we found 62 different themes. And when we brought them all back together, we were able to bucket them into 4 main categories that were really consistent across all of these responses. And those were understanding, which is just as it sounds, how well the parent understood what autism is, acceptance, to what level they were accepting that their child has autism, has this diagnosis, emotion, how they felt about their child receiving this diagnosis, and then coping, how they were responding and what they were doing to cope with receiving the diagnosis. And what we found was that there was pretty good understanding overall. So we did have about 12% of clients who didn't know much about autism, but the vast majority of families had good or some understanding of what autism was, which was really great to see, and somewhat against what we thought we might have seen. Then acceptance, 81% were embraced the diagnosis, and 19% were unsure. And unsure could have been denial or could have just been questioning. And we had some parents say, I'm not really sure if autism is the right diagnosis. I just think maybe ADHD, maybe we should get an evaluation for that. And so those ones fell into the unsure category. And emotions, this about 2/3 of families had a positive emotion that they were displaying in their response, and about a third were struggling and were responding more negatively emotionally. And with coping, the vast majority of parents were actively coping. Some were avoidantly coping, and it wasn't too surprising because these were folks that followed up on their diagnostic appointment and actually were enrolling in treatment. So these are likely the folks that are going to be coping in a more active way. So looking at the themes a little bit more closely and what we found, most parents who embraced the diagnosis had good or some understanding of what autism means. So what we took away from that is that understanding is really the foundation of the process of accepting and moving into a positive perspective on their child's autism diagnosis. And the parents who embraced the diagnosis also had more positive emotions and were actively coping. So this kind of showed us that it starts with understanding and then it moves to embracing the diagnosis, and that led to positive emotional responses and having the ability to employ more active coping mechanisms. A lot of parents understood that their autistic child's brain works differently, which is great. We saw a lot of that in our responses. We saw a lot of families say things like, I didn't know if it was autism or if it was something else, but I know my child is different, and I'm just really glad that I have a word now to describe what this difference is. And we also found that a better understanding of ASD is what leads to that greater acceptance. So the more we can help educate parents on what autism is, the better they're going to be able to identify with it and see it in their child and not be as afraid of it, which some families still were when they came to us. And emotion was an interesting one. We saw a pretty wide range of emotion, and this is actually the only one that had any discrepancy across the age groups. We had 75 kids in our sample for this paper, and we separated them into 3 groups. There were 25 of them under 6 years old, 25 of them between the ages of 6 and 12, and then 25 of them between the ages of 12 and 17. And we saw that the parents of the younger children were more likely to express emotion, and they were more likely to express positive emotion. So as the child's age increased, we saw that more concern was raised. There was more fear, there was more concern, there was less motivation, less optimism that was displayed. And the middle group, they were the least concerned and they were the most optimistic. So these are your school age kids. So it's possible that what we saw there was that they were already getting some help. They already had some support and some peer groups to help them, and potentially even knew some other parents of kids with autism and maybe had some models for what this might look like for them going through the treatment journey. We did find some parents who were hiding their diagnosis from their child and from their family as a coping mechanism, as an avoidant coping mechanism. And those parents typically showed emotions of fear or shame around autism. And this one was a challenging one for us to see, and it is something that we see in therapy as well. That when parents sometimes have an image of what autism is, and they feel that their child is on a certain trajectory. And that might lead some fear or shame if what they believe autism is a super extreme case that may or may not represent anything like the path that their child is on. And when that happens, sometimes these families shut down and they choose to hide the diagnosis from their child. And we see later on down the line that this can lead to some pretty difficult adjustments for the child. And then we also saw, again, that parents who embrace the diagnosis tend to present more positively and have active coping mechanisms in place. So the implications from this, what can you do? What can we learn from this? Understanding, I think the most important takeaway is not to make assumptions about what families know. There's a lot out there in the media about autism. There's a lot on Instagram and Facebook and all these different places about what autism is, and the word autism and neurodiversity are becoming far more popular. But we all know that if you've met one child with autism, then you've met one child with autism. So I think it's really important that we take the time to understand what the parents know, and connect them to adequate resources based on their current level of understanding. And acceptance is key. Acceptance is the most important thing that we've found in this. Acceptance is linked to lower levels of depression, more active coping strategies, the ability to tune to the needs of their child. Acceptance really is where the treatment begins. Once the family has accepted that their child has autism, then the work can really start to begin and understand how to modify their environment and see this child as different, but individual and beautiful in what they bring to the table once they learn how to tap into that. So look for signs of acceptance in the language that they use. We saw a lot of parents say things like, "My child's autism." And that was really helpful for us to see, okay, they've already embraced that. This is the diagnosis that their child owns and that belongs to them. Rather than parents saying, well, this diagnosis that they gave to my child, I'm not really sure about that, right? So just those little language things can really help you tune in to the parent's level of acceptance. And then emotion, we learned that it really is often related to where the parents are in their journey, and it's okay. Wherever they are in their journey, it's okay. Parents are going to have the emotional response that is right for them based on the experiences that they bring to the table and what they've learned. But when we see emotions of shame and fear, we really want to tap into those. Those are really powerful emotions that can start to drive families to more avoidant coping strategies. And the longer they take to move through that, the longer it's going to be before that child gets the full spectrum of care that is going to help them catch up in their development and gain the skills. So it's understandable that parents of older children might be feeling discouraged. They might be feeling like they missed their window. There's a lot of conversation about early intervention being key. And so some families may come to you feeling as though if their child is diagnosed at a later age, 5, 6, even 12, that this is it. They've already missed their window, but that's absolutely not the case. There's a whole array of different supports out there, and Anna's going to talk to some of the ones that Easter Seals Hawaii offers here in just a minute. But provide them with some encouragement. Early intervention is super important, super helpful, but it's not the end of the line if they weren't able to get in at that young age. And coping strategies. Look for those avoidant coping strategies and do what you can to reinforce the active coping strategies. Active coping strategies really is, in this case, any type of action that they're taking. It could be researching, it could be joining support groups, talking to different clinicians and physicians, experimenting with different things. If the families are doing something, then they're typically moving forward, because everything they do, they're going to learn from. And every child is different. And so they may need to try a variety of different strategies before they find what's right for them. And family therapy, of course, can help parents learn more active coping strategies and help them adjust during this time. Now, just a quick word on family well-being. That is where we're hoping to start to shift this conversation. That's really what we want to start to talk about and start to see is this focus on family well-being rather than this focus on just outcomes for the child with autism. Not to minimize the importance of the outcomes for the child with autism, but we do know that when a family has a child with autism, they have an increased risk of parental stress, family discord, they have higher divorce rates, and they have higher rates of mental health challenges that impact their family. So when we see a family coming in with a newly diagnosed child or somebody who's been diagnosed for a while, we often automatically want to focus on that child, and we're hoping that this can be an invitation to start to broaden that lens and really focus on the family overall. So when the family is healthier in whatever form it is, whatever form is right for them, it provides a calmer, safer environment for this child to progress and to learn and to grow into who they're going to be. And ways that we can do that as clinicians, focus on helping them increase their understanding. That could be pointing them to available supports online, different support groups that you guys may offer, therapy, Autism Speaks. There are all kinds of different things out there now where you can learn more. And embracing the diagnosis. I think this is a big one. Every person, every one of us, every child has strengths and we have challenges. And they're always going to look different. And while autism has its unique set of challenges that can sometimes cause a lot of frustration for families to understand, it also allows their child to have a unique set of strengths and differences that can be quirky, can be really cool and unique, and can lead to the child growing into a really beautiful, unique personality that has a lot of strengths to it. So reminding them of that and helping them see those positives. And emotional support, just support the parents on having a positive outlook in whatever way you can. I mean, this is not, it's not a death sentence. It is not a diagnosis that that won't progress in any way. You know, autism is a different way that their brain works, a different way that they connect socially and understand the social world and communicate and process things within their own mind. And there are a lot of positives to that. So help the families see those positives as much as you can. And then again, active coping strategies, reinforcing them for taking any action, anything that they're doing that's outside of their own mind, anything that is active. If they're reaching out, they're asking for help, they're doing anything to educate themselves or their families. We want to reinforce that and just get them moving forward on that journey. Because once they get on that journey, it's going to take on a life of its own as they support their child and their family to become whatever it is that they're going to become and embrace this new world that they're in. So that wraps up. I went and I wanted to make sure you had time today. So I hope I didn't go through too fast through any of that. But if you guys have questions or anything you'd like to bring forward, we can take a couple of minutes now for those.
I'll run the poll while we do Q&A for Michelle. Any questions for Michelle? No questions.
Well, thank you guys so much for giving me the opportunity to share the research that we've been doing. We have more that we're going to be doing. We have the unique data set from Easter Seals, Hawaii, that we're going to start to look into that will look just specifically at Hawaii and what's going on here across the different islands and across the different programs that we serve. So we'll be excited to bring that back to you guys once we do that as well. But thank you for having me.
Thank you, Michelle.
And then we'll wait for a little bit, and then Michelle, if you could go over your poll questions before we jump into Anna's portion.
Sure.
There
And
are
we have had a few questions that are starting to trickle in as well. I think everyone was focusing on their post questions, just as I was. And some of it may yet still come up, but the first one was ultimately the best way to refer to Easter seals. And then the
That I
second
think would
question
probably
was,
be a question for Anna. Anna, do you have our contact information on your slides that are coming up?
Yes, actually, hi everyone. I'm actually going to break down different programs and how they are delivered or how you can make referrals. So that will be provided through my slides.
and I think we're about 70% done. So if you want to go ahead and go through the questions, I'll end the poll. 75%.
Sure. So do I need to?
No, it looks like
click
everyone
on
got
the
it. Yeah.
results?
Everyone got it perfect. Perfect score, guys. I think it's the time I ever saw.
Yay.
Oh, good job.
I think we're good. And we can go
good
ahead.
job teaching us.
Yeah. We can go
thank you
ahead for
guys
the
for
second
listening.
half.
Okay. I'm going to start working on sharing my slides.
Okay, let me stop sharing. I might need to do that first here.
Thank you.
And I'll make sure that the two questions that are in the chat, I'm sure will get answered in your section, but otherwise I'll ask them again towards the end.
So just let me know when you want me to start. Thank you, Michelle, for such a great, interesting presentation.
You can start at any time, Anna.
Okay. Hi, everyone. I am Anna Stone. I am the Senior Business Development Director for Easter Seals, Hawaii and Northern California. I am so happy to be here. Thank you. On behalf of the Catalyte family of companies, Easter Seals Hawaii, I want to thank you for the opportunity to present our services today. So Easter Seals Hawaii is a local nonprofit dedicated to creating and growing high quality programs for care for people with intellectual developmental disabilities and autism. We have our purpose statement here. We're creating a more equitable world so people with intellectual and developmental disabilities can choose their path. We do this by reimagining how care and support can be better coordinated to fill gaps in human services across an individual's lifespan, thus improving well-being and outcomes for all. And that's one of the things in my role, is to actually identify the gaps in our community so that people who are not aware of the resources are able to know about them, to reach out to our network of stakeholders, and to providing outreach in places where resources are limited. So Easter Seals began in 1946 when Edward and Olga Sultan opened the Sultan Foundation Nursery School. With support from the community, this became the Easter Seals Society for Crippled Children. When adults with disabilities were added to our programs, we became Easter Seals Hawaii. The Sultan School offered the first early intervention of its kind in the United States. And today, early intervention continues to be the cornerstone of Easter Seals. Our main office is located in Honolulu. We are CARF accredited and are a statewide leader in serving people with disabilities. We average about 200,000 service hours a year. At present, we have these various locations for early intervention, adult home and community-based programs, as well as autism services. We have about an average of 2,200 clients per year. We have a team of experienced professionals that provide support throughout the journey, who keep clients and families in the loop, not just for the purpose of transparency, but also that they are an important part of the client's progress. So let me tell you more about early intervention. Easter Seals is contracted by the state and receives referrals through the early intervention services of the Department of Health. Our EI program offers comprehensive research-based services for children from birth to 3 years old who are diagnosed with developmental delay or who may be considered at risk of delay. An initial biopsychosocial assessment is conducted to determine the needs of the child and eligibility. So here's the phone number to call if you have an early intervention, you recognize somebody who's having biological at-risk condition or significant delay. This referral line will then assign your patient to the appropriate service based on their location. So it could be, it could be a situation that the patient will be referred to us or maybe another contracted provider. We recognize that each child is unique and it's not a one-size-fits-all. Based on individual assessments, children eligible for EI services will have an individualized family support plan developed by professionals with the parents to meet the child's development goals. These assessments are ongoing and are monitored throughout the program, and the types of services are tailored according to the needs. Children are evaluated at multiple points by social workers and care coordinators along the entire care cycle with a critical focus on outcomes. The model we use is based on the concept of family coaching to help empower the family. Our research has shown that family participation leads to greater outcomes, increased confidence in parenting with equivalent results in the confidence of the child, which results to lesser stress in the household. I am providing a recent white paper produced by our clinical excellence team on the powerful transformations shaping autism and developmental disabilities care, and that will be provided through the link. When the child is nearing his or third birthday, the Easter Seals families will help plan for the transition of the child into appropriate community settings, such as Department of Health Special Education, Head Start, or a preschool of their choice. While the family is receiving EI services, they will be receiving support as well as services from our team of professionals, the occupational therapists, physical therapists, speech pathologists, special educators, and social workers. So the EI program through the state ends at age 3, but if speech therapy is needed, we have a speech therapy program that could extend this up to age 5 through the Fish Fund Speech Language Program. The Oscar and Rosetta Fish Speech Language Program is a grant-funded service we offer our families that need additional therapy up to age 5 at no charge. This helps improve the child's communication during daily routines, boost self-confidence and self-esteem, and support the child's socialization with their peers and their family. So this is how it works. A licensed pathologist will conduct an initial evaluation to determine eligibility. If the child meets criteria, then up to 10 speech and language sessions are available through telehealth. For those who applied and did not qualify for DOE preschool speech and language services, this program may be the right fit. Please encourage your patients' families to reach out to Easter Seals for this particular program, and this will go on as the funds will allow us to do so. Our next service is autism. I want to feature autism services today. It's made up of registered behavior technicians and board certified behavior analysts who provide applied behavior analysis treatment. Autism services range from 18 months and older for people who are diagnosed with ASD. We also provide parent education services to families and behavior services to participants in the adult services program, which I will discuss in a little while. ABA is a common treatment option for individuals with ASD. ABA has consistently been shown to increase skill sets and decrease challenging behavior, with strong evidence to also increase communication and social skills. This treatment is delivered in different forms. Traditional ABA is a two-tier model wherein the registered behavior technician directly works with the client under the supervision of a board-certified behavioral analyst. This approach helps the family to implement the autism treatment. We also have parent-led ABA clinicians who collaborate with the caregiver to equip them with skills and procedures and education needed to effectively implement the ASD treatment into everyday family life. Parent training is important to support family members during and after sessions. Group therapy is learning and practicing a variety of social skills which are integral to optimal learning and boosting confidence to engage in positive interactions with others. Now, our autism services are provided through your referrals as providers and funded by health insurance plans. Easter Seal works with major insurance providers. Adult home and community-based services. This program enables individuals with disabilities to maximize their skills to independently care for their personal needs. Participants learn to interact with their environments, to move about their home and community, develop communication skills in social situations. The program maximizes the individual's potential to participate independently in age-appropriate activities. Easter Seal's adult home and community-based programs empower individuals to meet their goals through group or individual services. This program is Medicaid eligible for the certified developmentally disabled through the Department of Health. And I can provide that phone number as well later if you need it. Home and community-based services are offered in different ways. We have individual home-based services. Personal assistance habilitation, for example, is a one-on-one service with the purpose of developing independent living skills such as bathing, dressing, feeding, and cooking. This focus on building independence with tasks in the home, although we also focus on what interests the participants. The individual community-based services emphasizes, on the other hand, self-determination and self-advocacy. It is tailored to meet needs, explore their interests, and make connections in the community. Basically, learning what the resources are and knowing how to avail of them. One program we have is Adult Day Health. It's spending the day at our service center and the community for up to 6 hours of their day. The ratio of staff and participants varies on the type of activities. Participants have a full range of activities to choose from. For example, they have the option to go on excursions, enjoy art programs, volunteer in the community, attend computer classes with the aid of assistive technology, or learn money skills. One piece that we're excited about is employment services. Easter Seals believe that all people, regardless of diagnosis, should have the opportunity to offer their talents to the community if they want to. We have staff who provide exceptional individualized services that support community integration through competitive employment. A referral through the Department of Health Medicaid Waiver Services and the Division of Vocational Rehabilitation are required for eligibility for our employment services. So here's a scenario that we have. Somebody wants to work. They approach us and says, I want to be out there and I want to do something. Can you help me find a job? And so our staff will then have a time of discovery called discovery, where we get to know the clients deeper, what their strengths are, what their interests are, and what skills they either want to learn or they're able to contribute. And then we match them with a partner in the community. So we have done this with local vendors in the neighbor islands, as well as Safeway stores. And finally, we have behavioral health support that we provide to families, training, consultation, and outreach, such as what we're doing today. Thank you so much. I hope I can field your questions. If you have anything you want to ask, if you need more information, you can also contact me. This is my my email and phone number, and you can give me a call. Thank you so much.
Thank you so much as well. And thank you so much for sharing that secret contact information that I'm sure we've all been dying to have. And thank you. I think you were able to answer some of the questions that had been put in the chat. One was a little bit more specific and was asking if there's any resources and information you would have for parents with autistic children transitioning into from adolescence to adulthood.
Okay, so for autism services that we provide, again, this is available at our facility in Kapolei and also our facility in Vineyard, and also through telehealth. And what we do is we meet with the family. Our team at our Michelle Helis is our manager for autism services. She'll be able to discuss with the family what that specific need is. And so I can provide that information to you, telephone number for contact for that, to make an appointment and discuss a plan for that particular case.
It sounds like that's very much on a case-by-case basis, which I know is often, with our medically complex, fragile children. Similarly, it's so dependent on really what each patient has as a need as well. Let's see. So the question if there's a contact person for the Fish Fund.
Well, thank you for your question. We're excited about the Fish Fund. I believe I submitted a collateral material to Summer, and she will also post that on the link, so you can call the phone number, and then we will connect you with a person who will be able to assess that particular case and then develop a plan as well.
Wonderful. And then last question, at least so far, is if not Medicaid eligible, can an autistic adolescent or adult be eligible for those home and community services?
Okay, thank you for that question. The autistic adolescent or adult who needs autism services will have to connect with their insurance provider. And so we work with most insurance providers, and they're able to give us a plan or a schedule on how many treatments that they're going to have. But some of our autism clients actually have been with us for years, and it depends on what the insurance will allow them to have. So it's not necessarily a Medicaid eligible service, but through the insurance of the person, we're able to help communicate the need to the insurance provider, and they will give the approval for the treatment that we're going to provide.
Perfect. Well, I'm so glad we have you. It really sounds like at the end of the day, just getting back in touch with you with any of these more complex questions is really the way to go. I don't see any questions otherwise right now, unless I missed one further up in the chat.
Okay, you want to know the number for the fish program. Okay, so let me pull out using my phone. I have a flyer here. I believe it's 808-536-1015. So let me double check.
I think in the past, this is Lenny from PCDC Y&I. We have really appreciate having the fish fund when we refer our kids. We also provide early intervention services. We have a specific person we email to at Easter Seal. I know that person is no longer there, and I want to know, like, who would it be the contact person that we send those referrals to.
All right, Lenny, what service were you contacting the person for?
The fish fund.
The fish fund?
Yeah.
Yeah.
We fill out the application, then the family said, "Oh, who do we send it to?" Like they didn't know who to send to. So we're just looking for like an email address, a contact person to send that to.
Yes, so I believe it's on the screen right now. It's info@eastersealshawaii.org, or they can call this number 536-1015.
Will do. Thank you.
Thank you, Lenny. Do you have any questions for Michelle? Anybody have questions for Michelle?
I know you're getting all of them.
Well, that's great. That's the action part of it, right? The active coping mechanisms, getting you into treatment and taking some action. So that's perfect.
Mhm.
Exactly. And that's always the biggest and first step anyways, really, more than anything else.
I
If
guess
we,
I'm sorry.
go ahead. No, not at all.
I have other questions for those who have worked with Easter Seals in the past, and how it has, what their experience is like, or, what their feedback, or how the clients were helped.
Yes, I like this, bringing the questions back to the group. Excellent. So yeah, I as an inpatient doctor, I don't really have as much experience with it, but most of our providers are in the outpatient setting. So I would be interested as well if anyone has any anecdotes that they would like to share.
Oh, okay. I see that.
That is a very, very good point, actually, that you bring up, Alyssa. So she's saying, as a clinical social worker, have found it hard to get into ABA services for families who are non-English speaking.
Yes, I believe that we have to know who these clients are beforehand, so we can schedule an interpreter to be present in the situation. But just to let you know that we are also developing materials that will translate some of the information or the contact information that we have out there that are already in English to, we're working on something like that will communicate information to Chuukese and Marshallese families. So we're developing that material right now, and I don't know what kind of material non-English speaking clients that you have, but we recognize that this is a growing need in the community, and we are working on it.
Oh my gosh, I would also love all materials in all languages. And on that note, if you find translators that are, sufficient at actually translating, because so much of what so much of the words we have don't necessarily translate well into these other languages. And so it's something that we've been struggling with as well. We always want handouts in all the languages, but it's been difficult finding interpreters that are really able to, or translators that are really able to do so.
I am very familiar with it because that's also another part of my world. I speak Tagalog, and I'm also aware that, you know, not all the English words or the terminologies that we have in English have a translation in Tagalog. And so I know how difficult it is even for other, you know, other members of our community right now who are also in need of information, but they're limited also in their English communication skills. I acknowledge that.
No, absolutely. And as you said, we're experiencing it more and more. So it's definitely a growing need that we have. And sorry, I think someone was starting to talk and I interrupted.
Sorry, it's Lenny again. I'm just wondering, Anna, do you guys provide home-based services? Like you send your RBT out to work with the home, like families in the home?
Yes. Do you have a patient right now that you want to in particular refer, or is this a general
Yeah,
question?
we do. You know, a child will be aging out from early intervention really soon. And then they are not comfortable sending the child to school. So I'm like, you know, we're trying to connect the family with various resources, right? Particularly ABA. The child hasn't been diagnosed yet. We're working on it.
Oh, okay.
But if you have that, definitely a great resource. We want to share with the family and also with the Quest service provider coordinator. Okay.
If they are diagnosed with autism, I can easily refer you to our autism services. With early intervention, because they're in that that phase now, from what I heard from you, is the child is phasing out of early intervention. That may be something I will have to discuss with our team. If we can talk about it offline, then maybe I can give you some recommendations.
Sure.
So my phone number is 808-636-7139. That's my personal, that's my work cell phone number. If you want to maybe discuss it with me, and then I can field you, I direct you to the person to talk with.
Perfect. Thank you, Anna. I got it.
Thank you. I think nobody knows what Hawaii figures are. Mainly because they come in with no immigration documents. They can move in and out of our country without a visa. So it's very difficult. It's probably good to work with. We are Oceania. They are very familiar with our COFA migrant.
I would love to know our numbers as well, if anyone figures those out in the meantime. Okay, any last minute questions? We have about 2 more minutes that we can ask these ladies anything that we can think of. But in the meantime, thank you so much again. Thank you both for being here and answering all of these questions. I think resources and really who to reach out to, especially having like a direct contact, is always so important and one of the biggest hurdles, I believe, to really getting that ball rolling. So thank you so much again.